Doctor, I want to ask you, break down for our audiences as if we're almost, in class 5, class 6. How and what happens to the body when the body is intermittent fasting? I read some studies, articles saying that essentially your body finally starts breaking down the fat. Is that actually what's happening? How would you explain it to our audience?
So the principle of intermittent fasting, those were the protagonists or promoters of intermittent fasting. It is said that, and that's especially been shown in animal studies, that when you have, for example, a prolonged fast, let's say in humans it's about more than 15 hours or so, then you do start breaking down fat. And that is the concept. Now, the clinical correlate, and there's also other stuff. There's stuff that there is cellular regeneration, there is healing, there is anti-aging effect of intermittent fasting. A lot of that has been shown in animals and in experiments. But when you come to the clinical setting, like you and me are recommending to people or to our patients, the data that intermittent fasting is superior to conventional calorie restriction in terms of actual outcomes is very limited. So if you count the number of calories and the constitution of a diet that a person consumes, whether he does it within 8 hours or whether he does it over 24 hours, it really has not been shown to have a major impact on anything, on your blood pressure, on your blood sugar,
Okay.
on your liver fat. So there is some benefit, yes. Initially, when people start intermittent fasting, they see immediate benefits because there is a drastic change in their lifestyle. But over a period of time, it all evens out. So sadly, or at least at the moment, the promise of intermittent fasting in preclinical studies has not translated solidly or clearly into the real world.